Hello, my name is Isabel Gruntschober. I'm a researcher and lecturer in the field of instructional design, work-based learning, and educational technology at the University for Continuing Education, Krems in Austria. And today, in this virtual presentation for the EDULEARN conference 2025, I want to present our study, Professional Noticing for Sustainable Healthcare, Promoting Unlearning and the Implementation. And it is a study that I've done with my colleague, Alexandra Gössel. The study is about how we could support sustainability in healthcare. And we know that healthcare is meant to heal, but it is also harming the climate and also the people that are affected by it, the climate change. And all in all, 4.4% of the global CO2 emissions are contributed by the healthcare system. So this is something that we can work on. And today we want to have a closer look at what we can do to promote more sustainable decisions and practices in healthcare. We know that it is not enough to know. So very often, people who are working in healthcare know about the issues regarding sustainability, but it still doesn't lead to action very often. We have to notice, we have to reflect, we have to unlearn. And this is a transformative process, a process of change. And we need to identify, notice as unsustainable patterns, reflecting on them. And we need the capacity and also the support to unlearn. Today, I will first show you the research questions, the theoretical background, our methods that we've used, our key findings, and the conclusions. And let's start with the research questions. We want to know how healthcare professionals learn to notice and unlearn unsustainable practices. So the first research question is dedicated to noticing and how it supports the identification of unsustainable routines in clinical settings and clinical practice. The second research question is dedicated to the individual and organizational barriers, also enabling conditions that affect the implementation of unsustainable practices in the clinical settings. The third research question is dedicated to the interactions between professional noticing and unlearning, how it is connected to support a sustainable de-implementation. And the fourth research question is how we can support professional noticing and unlearning in educational methods and educational interventions to support sustainable de-implementation. Now, briefly to the theoretical background. What is noticing and what is unlearning? Professional noticing is a concept that is very well researched in pedagogy, especially in mathematics didactics, so instructional design for mathematics. And this is now like a summary of the phases of noticing, professional noticing. First, we are attending to significant cues. It starts with sensing the environments, but we don't notice everything. We notice what is relevant to us, to our profession. Beginners often miss key signals. Experts focus on what matters. What we notice depends on the experience, on the knowledge, or on the context. Then the next phase will be interpreting these cues. So professionals don't just see the things, they interpret what they mean. They use the knowledge, the context, and the reflection to do this. And experts are better at it because better at as the novices, beginners, because their knowledge is more flexible and they have just more experiences. Then the next phase is deciding on an appropriate action. After understanding comes the decision. This can happen either consciously or intuitively, and the experts act from experience. The beginners follows usually steps or a set of guidelines. Each decision shapes knowledge and influences future noticing again. And so here we have this arrow pointing back to attending significant cues. So as you see, there is a learning process happening, which is again informing what we think is relevant in our profession. But there are certain barriers to noticing. It could be cognitive overload, fatigue, stress. It could be biases, for example, the confirmation bias. It could be limited knowledge or experience, time pressure, institutional norms or hierarchies. Now we have a closer look at the term unlearning and how it is defined, or how do we define it in the study. Unlearning is the intentional process of questioning and letting go of established assumptions, habits, routines, and it enables us to reorient it. And there are two types of unlearning: behavioral unlearning, which is prompted by new rules, procedures, or explicit insight, and transformative unlearning, triggered by dissonance, disruption, or value conflict. And what we now think is relevant to the change that we need in healthcare is this transformational unlearning process. So we have here now this picture of the iceberg. So what we can see is the behaviors that are changing, but deep down, not only behaviors change usually for sustainable change, but also deep beliefs, values, identity. This is where transformative learning occurs. And it is usually not only linear or rational. It involves emotional work, professional vulnerability, and identity shifts. So as you see, it is something very fragile and very challenging for people. It requires a safe, reflective space for processing change. And also here we have barriers to unlearning. For example, psychological resistance or rationalization, lack of time or reflective space, or rigid institutional structures or norms. Now we have an understanding about the main aspects that we are talking about in this study. And now I'll show you our methods that we've used. We had an exploratory multi-step design, and we first had in the first phase a literature review, focusing on the areas of noticing, professional noticing, unlearning, and strategies for sustainable de-implementation. In the second phase, we did an empirical study. We had 4 in-depth interviews with Austrian public healthcare physicians, and based on problem-centered interviews, we gathered our data. Regarding the data analysis, we clustered in 3 categories, and all in all, we coded 179 segments. And now I will give you an interview of the results of the coding and the inductive-deductive content analysis. First of all, we identified sustainability topics that healthcare professionals mentioned. 6 key themes emerged: mobility behavior, for example, car reliance despite alternatives and so on, overdiagnosis and overtreatment, energy and device use, especially a lack of transparency in the public health sector, preventive care and the ecological and health benefits of it, waste disposal, for example, also lack of standards, and the resource use in general, so paper, disposables, redundant workflows. Then we identified the existing enablers of sustainable practice. And there were 5 key mechanisms. First of all, patient safety and preventing unnecessary interventions was named as an enabler very often. Economic logic aligning with sustainability, continuing education and peer learning, collective engagement and resource sharing among medical staff, and individual autonomy, allowing individual healthcare professionals to act sustainably in practice. Then we identified future enablers of sustainable practice. The 5 opportunities named were evidence-based restraint, meaning not doing certain interventions because it is just not necessary, neither in a medical way nor in other ways, that there should be clear guidelines and regulation. There should be digital infrastructure that could prompt or inform via dashboards, for example, or a better flow of data, sustainable decisions, and maybe also reduce the number of interventions. Incentives for patient-centered communication was named because building trust for patient-centered communication prevents unnecessary tests and treatments. So people don't look for many, interventions or tests or treatments to compare because they trust the doctor. This is the basic kind of logic behind of it that was mentioned. And there should be incentives to build trust, basically, to prevent these unnecessary tests and treatments. And also, professional development was named as an important enabler in the future. Now to the barriers of sustainable practice. The key challenges named were, at the individual level, time pressures, patient safety, and legal concerns. So very often they said something like that. So this is actually a quote from the interview. The good care of patient comes first. There are many things we consider before ever think about ecological aspects. So this is a very typical kind of neutralization strategy, saying that the patient comes first, and therefore we don't have a look at other issues like sustainability, even though these issues might on the long run again cause harm due to climate change and causing harm to the people, the humans that we actually want to make healthy and promote health. Institutional level, there are also barriers like a lack of ecological guidelines, low autonomy, and fragmented communication. So autonomy, this is a very interesting aspect, was named as an enabler and also as a barrier. An enabler because was autonomy if we individually could choose for sustainable actions, but also a barrier if there is too much leeway that people would also maybe not act sustainably, but rather not sustainable because of different kind of aspects. On a systemic level, cultural inertia, digital inefficiencies, misaligned financial incentives like not rewarding patient communication and so on hinder workflows. And on the cognitive level, there's neutralization strategies that I've already named on the individual level, like safety first, or we don't have time for that, and so on. They reduce the dissonance and block change. So these are main barriers that we found. Our conclusions. Noticing is a starting point for the whole unlearning process. And professionals show emerging awareness, and sustainability is a present theme, but very often rather implicit in daily routines. So we call this now latent noticing. The context influences what is attended to or questions, and barriers stem not from ignorance, but from structural and cognitive constraints very often. Noticing often focuses on inefficiencies and habits, that's what we found out. And noticing unsustainable routines alone rarely leads to action. And this is because, for example, neutralization strategies hinder suitable actions. Regarding our research question 2, we found barriers and enablers on individual and organizational level. The cognitive overload and limited mental resources make it difficult to question established routines. Very often it was reported that this very stressful daily work hinders them. And professionals may notice these unsustainable practices, but rationalize them, like already mentioned. Enabling conditions are peer learning and reflective dialogue, structured reflection processes to help professionals unlearn these ingrained routines. On systematic level, organizational level, we have the barriers are moral appeals alone are insufficient without structural support. So there needs some kind of support. Bottom up and top down has to meet somewhere. And the change requires both systemic transformation and cognitive shifts from the individuals. And the lack of alignment between regulation, education, infrastructure impedes coordinated action. Enabling conditions are that there are existing routines that could be used to amplify and scale up what already works without immediately introducing new policies. This would be possible. And existing routines often contain sustainable elements that can be just consciously reinforced. Regarding our third research question, I have here the recursive cycle of noticing and unlearning. This is what we call it, and showing the interactions between noticing and unlearning. And we see here that we can start at any point of this kind of cycle, but I could start here now just for, explaining it. First, we initiate unlearning. It could be because we see a dissonance or there is a trigger point or something like that where we understand that there is something weird or wrong, rather, maybe. And understanding that the actions that we had in the past or assumptions that they have to be changed, and accepting that, and also maybe being in this process of grieving past decisions that we did, especially in the health sector, that could lead to harm to the environment or maybe to people in the long run. This is, hard to accept and very often connected with the grieving process. But eventually it deepens the flexibility, the mental flexibility and adaptability and openness to notice. It sharpens noticing. We can go into practice and see different things now. Because we are primed by it, by the prior aspects that happened to us in the unlearning process. But of course, as we already mentioned, this noticing is, there are these barriers to noticing, like time pressure, cognitive overload, and so on, that can prevent noticing. So we have to address these barriers in noticing to make the overall learning experience more, or unlearning experience, more effective and impactful. Then we notice these inconsistencies, these discrepancies in routines. And here again, there is this barrier of these naturalization strategies we've talked about. So it could be that we notice, but we don't act on it because of the neutralization strategies. And therefore, there is no unlearning afterwards, right? So this is like a cycle that is always going on, and it could also be that there are some kind of feedback loop in between these different phases also, so this is not like a linear process. And all these phases can be supported by peer learning, which is bridging recognition and action. And professionals notice issues and they rationalize them through these naturalization strategies. So we can address this also in debriefing sessions or in educational kind of educational interventions. So all in all, professional noticing sparks awareness. Unlearning transforms that awareness into change, and reflecting and social learning connected to and foster sustainable practice, all in all. And this peer learning is a very important driver or mechanism, actually, to support the grieving process of unlearning. And now, lastly, to the last question, how can targeted educational measures promote professional noticing and unlearning in support of sustainability implementation? First of all, we have to build knowledge and awareness. We have to teach sustainable decision-making as a professional skill. So that's important. We need to incorporate evidence on the climate impact of clinical practice. We have to use digital tools, dashboards, interactive checklists, and so on to support sustainable evidence-based decision-making. And it is helpful to use studies, simulations, case studies, simulations, video analysis to train noticing in practice. We have to enable critical reflection, so create a safe space for reflection, use structured reflection to unlearn unsustainable routines, identify and address neutralization strategies, and encourage facilitator-led debriefing to strengthen noticing and learning. And then we should leverage social learning, because it helps us to recognize how changes affect our professional identity. And it is just important to support emotional processing during the unlearning process. And we need to acknowledge that emotional work of unlearning and support that it is emotional work. Unlearning is emotional work, and we need to support identity negotiation in groups as a collective process, collaborative process. And lastly, we can reinforce what already works. We can highlight good practices and the drivers. Is it ethical, efficiency, or norms? We can change by starting scaling what works, and we can build on routines that are already aligned with sustainability goals and foster scalable impact. And that's the end of my presentation. Thank you for your attention and for staying with me. And I'm happy to get in touch with you online on LinkedIn or on Instagram. I also have a researcher's blog called isabelgru.eu, and I'm happy to get in touch with you and discuss our findings.